welcome back. Today we're talking about something extremely exciting, well, for everyone. It's about cosmetic surgery, and we are going to discuss the reasons why people should get cosmetic surgery, shouldn't get cosmetic surgery, and what is recommended generally. So I have my three colleagues here, and take it away, Dr. Oyelese.
Thank you very much. Good day, everyone. So yeah, we're going to be discussing about cosmetic surgery. Generally speaking, there's medically necessary cosmetic surgery, and then there's the aesthetics, part of cosmetic surgery as well. And you'd be surprised that children, also require cosmetic surgery in some degree, and we'll go into why, they may need that. As for the medically important cosmetic surgery, yeah, children, sometimes are born, unfortunately, with congenital anomalies. One of the more common ones will be a cleft lip and palate.
Very common.
And if you've seen a child, an older child with a cleft lip and palate that was not corrected, you'd be able to tell how much it's going to damage, the child's self-esteem. So the plastic surgeons are usually the ones that are in charge of, doing the corrective surgery, and these surgeries they usually do.
They do it in stages too,
Yeah,
from birth.
From birth.
Sometimes they start with the outer, with the lip before they correct the palate, but every time a child is born with an abnormality, you get all the people involved. ENT, because that can also affect the way they suck.
Yes.
And they have a special nipple called a Habesham nipple that they can't drink normally with normal nipples. So those nipples are very soft and they go all the way back.
Yes.
Because most times when a child is born with cleft lip, the palate also has a big hole, and
Yes.
cleft means there's an opening. Basically, there wasn't a complete fusion of the lips, and that can also go all the way back into the back of the throat. So you have a line just going, like someone took a knife and just made a division in the back of the in the lip, going all the way to the back of the throat.
Yeah.
And it can affect their speech too.
Yes.
So a lot of those children, they have to be seen by occupational therapy when they're born. They have to get that specialized Habesham nipple. Well, that was what it was called last time I checked, so it might have changed now. And then most times they also need like a lactation specialist for the mom so that they can feed the baby properly. If the mom decides she wants to breastfeed, that can also come with concerns. So that already is not just cosmetic surgery, it's a whole multidisciplinary team that's managing children like that.
Yes.
But there are other reasons, and please go ahead. Go ahead and talk about other reasons, medically necessary.
Sometimes, unfortunate accidents in the home like burns, or even, trauma that could cause some scarring, could require for children to have some form of cosmetic surgery to be done. A skin flap sometimes is raised, to cover extensive burn injuries, or even if a child falls and has a bad wound, some form of cosmetic surgery could be done for that. Other congenital anomalies or things like birthmarks, that's a nevus,
giant nevus, all those like on one part of the face. Some babies you see they have like hair, and they could be white babies or black babies, any race, and you just have like a whole. It's like you're wearing a mask with hair and hyperpigmentation, and it's just the whole face. Then there's the Sturge-Weber syndrome where the fifth nerve, the part of the face is just a different color from the rest of it's there's a whole lot of different congenital abnormalities. And when you think that congenital abnormalities can be in the ears, some babies are born with microtia, tiny little ears. So this ear is normal. You look on the other side, those children, you also have to check them out for hearing deafness, because they might have abnormal, not just external ear, middle ear, and inner ear. They might have no cochlears, so they might be deaf on one side. And we get ENT involved in those children. And talking about cosmetic surgery, what about all these GI abnormalities when babies are born with gastroschisis?
Yes.
The gut is out and this, or omphalocele. Omphalocele usually come with the membranes covering it. Before I went to do my training in America, there was a child that I delivered. That child was born with gastroschisis. The GI tract was all over the place. This was decades ago. And because the child was born in a resource limited country, we just had mom hold on to the child until the child passed. I get to America, and before the baby is born, they've already diagnosed this child is coming with gastroschisis. The plastic surgery team is there. So as soon as the baby was born, the child was intubated first. The tube was put down the throat. They were put on a vent and taken to the ICU. And then they were put in a silo bag. All that intestines that's hanging out was put in a silo bag, hanging from the bed. And then every day, because you can't put all of it back into the GI tract because it would be too big and that thing can explode. So every day as the child got bigger, or every 2 days, every 3 days, the plastic surgeons are pushing that intestine back into the stomach. And eventually the child, remember that if you push it too fast, you can stop the lungs from expanding. Those children are on vents. So as the stomach expands and with the gut, the lungs are still expanding because the child is mechanically ventilated with a ventilator. And in like 1 or 2 months, those children go home and they're fine. But those children had to be on special I and O, input and outputs. You had to monitor their weights every day. They were very, very closely monitored. You had to also monitor their electrolytes because those intestines are out and they're losing a lot of electrolyte, potassium, all their imbalances. So you have to keep correcting them. You know, the thing about pediatrics that I love, once you take care of the tiny details, you can't go wrong.
Yeah.
And that sterile environment, you need to make sure that before you even touch the child, you're wearing your gown, your cap, your mask, pushing those intestines into the silos. And the next minute you see that child coming and the child is a basketball player with the NFL or NBA or whatever. But it just goes to show that there's a lot of preparation that comes in cosmetics. Plastic surgery there's a lot to do with reconstructive surgery.
Yes.
There's also a lot to do with changing the way someone looks. And then there's the optional surgery, which we were talking about before we started this. And that is well, it's not the necessary one. It's the one that is desired, where someone desires to look a certain way and then they want to change their looks and become look different. So that's plastic cosmetic surgery that is not medically necessary.
Yes.
So what would you say about that?
I'm not sure we see a lot of
Not in Nigeria.
cosmetic surgery for the purpose solely for beautification, especially in our pediatric age group. It's not like something that is really seen. I think we talked about some cosmetic surgery grafts for dog bites in some kids.
Yes.
Where you know the dog really just
Chewed up the child's face.
and that
Yeah.
kind of stuff. So I mean, all this use of cosmetic surgery is definitely to correct some sort of deficiency for children, mostly for adolescents as well. I think the other one is more for like
Adults.
Also,
Yeah, it's beyond the scope. But it's not necessarily beyond the scope because a lot of people that do plastic surgery many times has to do with self-esteem also.
Yes.
So before you go and start getting that nose job, what did we talk about? Brazilian butt lifts. I told us before the talk, we were talking about a lady in the airport who had done a Brazilian butt lift and she had something on the back of her pants at the back saying, "Stop looking at my butt." You know? And it was so funny because it was walking through the airport and it's like, what's going on over there? But you know, sometimes when you see people that have done plastic surgery, it looks quite artificial. And you see some women, their waists are like this and their butts are their buttocks are like so huge and then the legs are skinny. And the problem that we see in medicine, you don't know what they've put in those. Sometimes they put sterile water in those implants. People go and get boob jobs. They can put all kinds of stuff. There's a lot of, in the past, there were people that was getting sued, doctors were getting sued because they were using silicone implants for breast jobs. And the most important thing that we as pediatricians want to pass across to you with this talk is, by the time you have a child that is going to get plastic surgery to change their looks or to make themselves feel better, there's a psychological problem behind those desires. Now, if you're a grown woman and you've been trying to exercise and lose weight and you need your stomach reduced, some people will go and do the flaps and the stomach surgeries, the sleeves, gastric sleeves, all that kind of stuff to lose weight. Now, if it's medically necessary, your blood pressure is high, your everything is high, and you want to do all those just to lose weight, that is one way of regaining back your health. But as children, as physicians for children, when we don't see plastic surgery in a lot of children that they want to do it because they want to change their faces or anything like that. But when it comes up and people talk about, oh, they want to get a boob job because they feel that their breasts are too small, or most times when children are just developing, sometimes their breasts are small. And as they get older, it gets bigger. Some people complain about their breasts being too big and they want to get breast reduction surgery. And a lot of times we do recommend that if it's medically necessary, if they have like back pain or they're extremely uncomfortable and they have other issues from that, then yes, they should go ahead and do it. But for cosmetic surgery that is necessary, we definitely recommend it. But for the one that is optional,
aesthetics.
If it's just aesthetics, you want to be psychologically prepared first before you go and start changing your looks, because a lot of that has a lot of long-term effects that the children might not be ready for. And then now you talk about other things coming up, which is beyond the scope of this talk. When you have like sexuality issues, a girl feels that she wants to be identified as a different sex from, or a boy feels he wants to be identified. Ideally, in Nigeria, that's not happening, but it's something that if it ever comes up, it's always important for parents to have some inputs in their child, especially if a child is a minor. It's not something that a child wants to navigate on their own. So you want to do it with family, you want to do it with psychologists and psychiatrists available, or just counselors, so that people are not taken advantage of, because it's easy to want to do something that at the end of the day it might affect your health on the long run, and then you might regret what you've done, going down life. Yes. As life is happening, you'll be like, oh, I wish I'd not done that. So I would just suggest parents be active in your children's lives, know what's going on with them. If there's anything going on that you're not happy about, seek professional help. There's a lot of counselors out there. There's a lot of people that can help to make sure that this thing we call life is easier for your children, especially if they're having issues with wanting to do cosmetic surgery because of different reasons. Okay, so anything else that you want to add?
I was going to ask, so for the case of, let's say, a teenager that has like a very excessive breast tissues and definitely causing some form of back pain, all that stuff. So such surgery, I don't think it is now just cosmetic surgery for the purpose of aesthetics or just beautification. At this point, even though it is like a breast reduction or let's say breast lift, at that point in time, it is also just to relieve
the child of the burden.
Yes. Carrying excessive
breast tissue. It's true. You're right. I agree with you, and that's a very good point. That's not cosmetic surgery. That's medically necessary surgery. Because by the time you cannot function because you have too much boobs and it's causing back pain, you can't sleep, and it's actually medically necessary. It's no more an optional cosmetic surgery, and we don't do it a lot here in Nigeria. But I have seen patients that have done it and their lives changed.
Yes.
They could go to do sports, they could do more activity, they could dance and not feel like they were carrying a house on their chest. you know, and you're right. I agree with you 100%.
I've seen one case like that,
Yes.
you know, and it was, the change was miraculous. The girl was, you know, really
Able to-
happy about the
Yes.
difference.
Because no matter how much weight you lose,
Mm.
that breast tissue just doesn't go
It's
away
very fast.
that fast. You know, here in Nigeria it happened.
Yes,
Yeah,
yes.
yeah.
Here in Nigeria, she had really bad gynecomastia, you know, and they just had to, you know, take out most of the breast tissue.
Yeah.
You know, afterwards, her quality of
fine.
life was much improved.
So they did that surgery here in
Yeah.
Nigeria.
Yeah. That,
Wow.
This was
We
maybe
have
2 years
we
ago.
have friends that came from America to do that surgery here too.
Oh.
Yeah. So we do have those services available, but rather than the children suffering, it's always better to get a good surgeon and see if the child is a candidate for breast reduction surgery, for sure. It's interesting. We started talking about cosmetic surgery and then we now put it, but that one is medically necessary. That
Yeah.
one is not.
Mhm.
Yeah. And then anything else?
Yeah, so I think, in Africa, most of the time, you know, most kids, even if they have self-esteem and all that, I don't think most of them feel so free, you know, having to even mention it to their parents. It's usually in the Western world that we see that opportunity to be able to say one or two things. So I think parents should also try to, you know, listen to their children, in as much as it's not everything that they're going to, you know, take from them. But if they feel that the child is a little bit worried, they should just reach out to, you know, the professionals, you know, to know if they need the surgery or
Or not, yes. So please reach out to your doctors if your children seem to be struggling in a particular area with something that can be easily fixed. Please go ahead and help your child out. And there's so many other things that come up, and parents are like, that's the way we are. We were born with big boobs. So why are you trying? Why is your case different? Listen to your child, because a lot of things have changed, and if whatever help you need to get, just talk to your doctor. If you don't have a doctor, we're happy to see you at Pediatric Partners. All right. Anything else? Did we miss anything? Well, if we did, then there'll be a sequel to this one. So please subscribe to the social media handles at the bottom of your screen, and we look forward to seeing you next time. Thank you and have a good day. Bye.